Rahim. Hello friends, Assalamu alaikum. Welcome to my YouTube channel, Dr. Abid Sargani. Viewers, today we are going to discuss about another important topic in our animal husbandry and veterinary sciences section, that is basic surgical instruments, their functions, types and various parts of the surgical instruments. Basically, there are 5 major surgical instruments which are used in any kind of the surgery, major or minor. So let's discuss and see that what are these instruments and what are their functions and what are the types. In which very first is surgical scalpel. Surgical scalpel is used to hold the blade. It usually consists on two parts. First one is a handle and another one is surgical blade. It's used for step incision. Surgical scalpels, there are various types of the surgical scalpels, basically 3 on the basis of the number, in which very first is number 3, on which blade number is loaded. 10, 11 and 12 number blades are loaded on this scalpel handle. Another one is scalpel handle number 4, onto which the scalpel blade number 21, 22 and 23 is loaded. And last one is number 7. This is usually a thinner and most recently developed scalpel handle, onto which the surgical blades of the similar to that of scalpel handle 3 are used on this scalpel handle number 7, that is scalpel blade number 10, 11 and 12. So another one instrument, that is surgical scissors. Surgical scissors are primarily cutting instruments. There are various types, mainly there are 3 types. Number 1 is a sharp scissors, in which their point is sharp. Another one is blunt, their points are blunt. And third one is sharp scissors, sharp blunt scissors, in which one end or the one hand of the scissors is sharp, another one is blunt. These surgical instruments or surgical scissors may be curved or straight. Surgical scissors are of various types, and namely for their proper uses and functions. Number 1 is Lister bandage scissor. This is curved at their jaws are curved, and this is mostly used in plaster of Paris cutting. And another one is Mayo scissors. Mayo scissors is used to cut the muscles and soft tissues. Second is Iris scissors. Iris scissors are used for the ophthalmology surgery, means in the eye surgery or other soft delicate tissues. Last but not least is Metzenbaum scissors, which are used for the to cut or incise the delicate and soft tissues. So the next are what are the parts of the scissors? There are various parts of the scissors. Number 1 is eye ring or the ring handler. Another one is shank. Third is pivot or box lock or pivot joint. This is the whole region. And fourth part, and this is pivot or box lock or the pivot joint, have the pivot screw. This is pivot screw. Another one is last part, that is surgical blade onto each handle or the shank. The blade have the various parts. First one is point or the tip of the blade, and second part of the blade is cutting edges, which are used to cut the are in size the tissues. Cutting edges are also known as the bevels, or there are sharp margins on these scalpel blades. These are called the cutting edges. And shear beds. This is shear bed, which is some like fillet. These are two. So this is the anatomy of the scissors. Another instrument which is most commonly used in surgical practices, that is needle holder. Needle holder is used to hold the surgical needles while suturing or while ligating the tissues or the arteries. Needle holders are also known as the needle drivers or the needle forceps. There are two types of the needle holders you are watching in the slide. Number one is Olsen-Heger needle holder, which having the scissors. Simultaneously, while holding the needles or suture material, it also cuts that suture material, silk or chromicated. Another one is Mayo-Heger needle holder, which have not the scissors. They both functions have the to handle the or to hold the needles. The identification characteristic of the needle holder and the artery forceps is that of groove-like structure in the jaws of needle holder, which is absent from the artery forceps. Parts of the needle holders. There are various parts of the needle holders also, like that of scissors, in which very first part is jaws. This is the jaw anatomy. And second one is joint, similar to that of the scissors. Another one is shank. This is similar to that of scissors and rings. Another one most important part is that of ratchet. Ratchet is used to lock this needle holder while suturing or it to the needles. There are also serrations on the jaws of the needle holders. Forceps. This is an important instrument which is used in surgical processes, that is forceps. There are various types of the forceps used to hold the tissues or pick up the swabs, etc. Number one is artery or the hemostat forceps, which are used to block the bleedings or to ligate the arteries or the blood vessels. Another one is halostat mosquito forceps. This is also a type of the hemostat forceps, which have the size of only 3 inches. Another type of the artery forceps is that of Cayley forceps. And the last is Crile, which is also type of the hemostat or the artery forceps. The major difference between the Cayley forceps and the Crile forceps is that of the serrations on their jaws. As you see that in Crile forceps there's full serrations on the jaws, while on the Cayley forceps there is 2/3 of the jaws is serrated while others is plain. This is another type of the tissue forceps or the forceps, that is thumb bar tissue forceps. Thumb bar tissue forceps may be plain or may be toothed. Number one is Edison thumb forceps. Second one is red toothed thumb forceps. And the last one is towel clamp, which is used for the swabbing or scrubbing the area, or sometimes taking the swabs or the cottons. Other types of the forceps or thumb forceps or tissue forceps includes these titil forceps, which is used to pick and transfer the tissues or the material from the internal viscera. And another one is Ellis tissue forceps, which is most commonly used in the surgical processes or the in hard tissues. Surgical needles. This is an important, that is surgical needles which are used for the suturing purpose in surgery. Anatomically, surgical needles consist on the eye, which where the we implant or we use the to knot the suture material, silk or chromic catgut. Sometimes they are also swaged or sometimes they are not swaged. Another one part is body, which is elongated tube, and third one is point, which is tip. Sometimes needles comes in swaged or the suture material is attached to the needles. It is better than the not swaged needles because they reduce or minimize the puncture to the tissues. There are various types of the uh, surgical needles on the basis of their tips, and there are also various types on the basis of their diameter or the circle of their body. Number one is on the basis of tip is fine point. This is thin flat profile especially designed for ophthalmic anterior segment surgeries, means eye surgeries, uh, where the needles is used is fine point, fine pointed. Another one is reverse cutting, on which the cutting edge on the outer curve is sharp. Another one is soft cut, cutting tip and taper body. Another one is precision point and taper point. Another last one is conventional cutting scissors. These are the various types of the cutting, conventional cutting needles. This was all about our lecture in animal husbandry veterinary sciences about the basic surgical instruments and their parts and functions. Hopefully you will understand this lecture. Any query regarding to this lecture, you may ask the questions. Thank you very much. Khuda Hafiz.